Hi, my name is Juliana Cruz, and I am a student from South University. Can you please tell me your first and last name
Adam Loveday,
and your date of birth?
7689.
Okay, and what are you here for?
I'm here for an assessment.
Good. Can you tell me where you are
I'm home.
and today's date?
It is January 18th.
Okay, and do you have any thoughts of harming yourself?
No.
Okay. Patient is alert and oriented ×4. General appearance matches his age, and he is addressed appropriately for season, and he doesn't seem to be in any acute distress. Okay. So prior to your examination, we did your vitals, and you are 5'11", and you weigh 215 pounds, which puts your BMI to 30. I'm gonna continue on with the physical assessment. Washing my hands. Alright, so for the skin, it's pink, warm to touch, no lacerations or lesions, or irregular moles noted. Good. I am going to start now with your head and your scalp. If you feel any tenderness, if you can please just let me know. Okay? Cephalic, which is good. Hair is thin and brown and it's evenly distributed. I don't see any infestations or indentations of the scalp. I'm going to go down now to the face. I'm checking temporal pulses, 2+ bilaterally. Can you clench down? I'm going to check for TMJ. Very good. Any tenderness there?
No.
Okay, very good. I'm going to check now your facial movements. If you can please raise your eyebrows, smile, push out your teeth, and stick out your tongue. Good. So it is symmetric. Now I'm going to be checking for cessation of your face. If you can just please tell me if it's dull or sharp. Okay?
Dull. Sharp. Dull. Sharp.
Good. I'm going to check your eyes. Prior to coming into the exam room, we used the Snellen chart, and your visual acuity was 20/20 for right and left eye. I'm going to check for cranial nerves, which is 2, 3, 4, and 6, and this is just a matter of just following my fingers, okay? No nystagmus noted. Eye movement is symmetrical. I am going to be looking at your reaction to light, to the pupil. All you need to do is just look straight ahead at me. Very good. They both constrict. I would document perla is noted. Pupils are +3 and equal. They're round, reacted, and accommodated to light. Now I'm going to be assessing your peripheral vision, okay? I'm going to come from behind you, and this is called confrontation. If you just see my fingers wiggling, you just let me know, okay?
Yep. Yep.
Very good.
Yep.
Very good. Now I'm going to be looking at the structure of the eye. The conjunctiva is pink and moist on both sides. The sclera is white and shiny. There's no jaundice noted. If we were in a clinical setting, we would look more internal of the eye, which would be looking at the optic disc, more of like the nerves and stuff. But next I'm going to be looking at your ear. And this is testing cranial 8. I'm going to stand behind you. This is called the whisper test.
Okay.
And just cover the opposite side of the ear. And just follow my words in a sequence.
1, 2, 3.
Opposite ear.
January, February, March.
Good. So now I'll be looking at the exterior portion of the ear. I'm looking for any breakdown or lesions. Okay, very good. You do seem to have a single piercing there. No lesions, no breakdown. I'm going to be looking at the inner portion of your ear. Canal is patent, no drainage. The tympanic membrane is gray and pearly, no perforation. And then the light reflection is at 5. Looking over to the next, if you can just turn for me.
Mhm.
Perfect, thank you. Pulling up and back. It is great and curly. No perforation noted. Light reaction is at 7. And if I was at a clinical setting, I would test your hearing with a tuning fork or Weber's test, which cheches the laceration to see which one is more prominent than the other, or a Weber's test, which cheches air and bone conduction, which is air is greater than bone.
Okay.
I'm gonna move on to the nose and your sinus. I'm gonna look at the external portion of the mirrors. They're both patent, bilaterally. Internal mucosa is pink and moist and warm. Okay. Your frontal sinus, I'll be checking. Let me know if there's any pressure. How about your maxillary?
Nope.
Any tenderness? Nothing?
Nope.
Which is good. Let's see. I'm gonna be looking at your mouth, your inner portion of your mouth, and at this portion, I will make sure that I put on gloves, okay? And this is checking cranial nerves 9 and 12. I'm gonna look at the okay, pink and moist, no lacerations or lesions noted, all teeth are intact. Stick out your tongue for me, please. Uvula intact, no involuntary twitching. Hard palate is intact. Say ah. And then there's no exudate to the posterior part of the throat. Or irritation or redness, which is good, or edema. Very good. I'm gonna check your neck now. If you can just do a few range of motion exercise, if you can hyperextend and flex your neck, front and back, side to side, and rotate. Was there any pain or restrictions or limitations?
Nope.
That's good. I'm gonna be checking cervical lymph nodes, and as I palpate down, you let me know if there's any tenderness, and I'm gonna just say them out loud. Auricular, post-auricular, occipital, posterior cervical, tonsillar, mandibular, segmental, supraclavicular. I'm gonna go down to your pectoral areas underneath the axillary. I'm gonna press deep down inside. Any pain?
Nope.
Okay. And how about back here? Any subclavicular pain?
Nope.
Okay. Now palpable, which is good. I'm assessing the shoulders for symmetrical. The clavicle is symmetrical. I'm gonna touch. If you can go up and down, rotate, other way. Kind of go like this. Very good. Up and down. Okay. I'm gonna just check your thyroid gland. Can you swallow for me? Non-palpable. There was no nodules on palpitation, which is good. How are you feeling?
Good.
That's good. I'm gonna be continuing now down to the arms, and I want to let you know if there's any tenderness, just let me know, okay? Any tenderness?
Nope.
I'm checking for your lymph nodes here. Any lymph nodes? I'm sorry. Any tenderness?
No, ma'am.
Okay. Can you do range of motion with your arms side to side and around? Is there any limitations? So now completing the assessment, I would still say that the upper portion of your assessment is, for your extremities, are 5 out of 5. Let's see, what's next? I'm just gonna. I kind of jumped ahead of myself. I'm going to be checking for the carotid noted now. Let me just feel on the opposite side.
Mm-hmm.
And I'm going to listen with the bell of my stethoscope. No acquisitions or bruising noted. Now I'm going to be listening to your chest here. Aortic. You could just read that loudly. Pulmonary. Tricuspid. And pulmonary. Okay. You can just turn around for me there.
Mm-hmm.
You can state 99.
99.
And again.
99.
Okay. I'm just percussing 6 areas here. Do you have any CVA tenderness?
No.
Okay, good. And when I touch each area with my stethoscope, if you can just say 99, okay?
99.
Good,
99.
good,
99.
good,
99.
good. Say E.
E. E.
Good.
E. E.
No adventitions breath sounds. Lungs are clear bilaterally. If you can just please lay down for me, I'm going to take a look at your abdomen, okay? Okay, I'm looking for striae, any masses that are notable, any herniations that are notable. Okay, I am going to take a listen.
Mm-hmm.
Listen for at least 15 seconds. Listen to the abdominal aorta. Now, listening to the renal arteries, iliac arteries. Good. Now I'm just going to be checking for the size of your liver and spleen.
Okay.
As I'm pressing, it should be tympanic. Typical adult size is between 16 to 13 centimeters. Percussive. Very good. You can take a deep breath and hold it. Any tenderness?
No.
Okay. Bladder is non-distended. Okay. And I am going to palpate. Is there any tenderness?
No.
How about when I release?
No.
No? Nothing?
No. No.
You can just lift up your knee. Good. Any tenderness?
No.
Okay. If you can just lay on your side,
Mm-hmm.
I'm going to have you bend your knee up
Mm-hmm.
and flex it. Any swelling or pain or limitations there?
No.
Good. If you can lay back on your side. I'm checking for skin color, any ecchymosis, any redness. Okay. I'm going to do some range of motion to the leg. Let me know if there's any limitations. I'm going to lift up and over and back. Very good. And now to the opposite leg. Lift up and over, down and back.
Okay.
I'm gonna check for pulses in the leg, okay? Checking for the femoral. Good. Popliteal. Dorsal. Posterior tibial. At this time, I'm going to use an object on your legs. If you can just tell me if it's sharp or dull. Can you close your eyes? Okay.
Sharp. Dull.
Good.
Sharp. Dull.
Okay. If you can push down to my feet, to my hands, good. And up. Very good. And now just kind of just bring your feet like up. And then towards you, bringing them in. Very good. I would say 5 out of 5 for the lower extremity for your strength. If I was at a clinical setting, I would use a hammer to check for reflexes. Do you mind if you sit back down for me?
Yeah.
So, bicep, tricep, brachial, bicep, tricep, radial brachial. Very good. Can you kind of just copy what I'm doing and see if there's anything hurt? I'm gonna try rapid motions. If you could just kind of copy what I'm doing with my fingers. Okay, and the same with your feet. Very good. Let's see. If you can stand up, I'm gonna check your spine. If you can just bend over. Any pain while I'm bending?
Nope.
Any restrictions that you feel?
Nope.
Curvature of the spine is good. If you can just put both of your feet together and hands out. And I'm just checking for your balance right now. Very good. You might press against you a little bit, but don't be startled, okay? Very good. Can you walk a few steps for me? Very good. Very good. You can sit back down. Walking is intact. So we were able to check the range of your motions of your legs. I checked your pulses. Your legs look good. There's no ecchymosis, no lacerations, no scarring, no swelling to either side of the legs. I didn't notice any edema on your lower portion of your legs, which is good. And you said when we did the exam that there was no restrictions as we did the range of motion, and that was for your hip and for your lower part of the extremity. A few things that I kind of just forgot. I'm gonna check your skin turgor, which is good. I was able to check to see how your balance was. I was able to listen to your lung sounds and do a full assessment. Is there anything that you would like to ask me, or any questions about your assessment today?
No, you did very good. It was very informative.
Okay, thank you so much. And again, I am a student from South University, and if you have any questions, please feel free to reach out.
Okay, thank you.
You're welcome.